I first knew something was very wrong when he phoned me from the rowing club and said, I've had the most intense session, the most physically exerting session I've ever had, and I feel nauseous. And as a nurse, I just thought nausea, cardiac, that was the first thing that came to my head. He was stumbling, he couldn't walk properly. I think your legs had begun to give way at that point. I felt a horrible feeling of how had I allowed this to happen in the first place. I felt very responsible that I was a nurse, I wasn't stupid. This was my husband and this was going on under my roof and I allowed this, and I felt awful. And I'd always kind of been a people pleaser, and I thought, I don't care if he hates me. I don't care if he chucks me. I am not going to allow him to eat any more crap. That's it. And we're gonna fix him. That was my primary concern.
I wanted to produce a plan that was based upon the best available evidence that people could adopt, and really a prescription, if you like, for people to prevent heart disease, but also, in Mike's case, be part of the treatment plan. Pioppi is a village in southern Italy. It's considered one of the world's healthiest villages, and it has a population of around 200 people. The average life expectancy there is close to 90 for both men and women. A lot of people live over the age of 100. And myself and my co-author of the book, a former international athlete, Donald O'Neill, we went to this village to try and discover the secrets of what it was that made them live healthy for a very long period of time. So we call a healthy lifespan.
Yes.
There's no chronic disease there. They're not taking lots of pills into old age. They're very active. And how do we marry those secrets with the best available evidence that we have around nutrition and lifestyle and health, so that we can empower people to change their life for the better?
No, I was a bit of a junk food addict. So the usual, probably skip breakfast, a few biscuits at sort of mid-morning coffee break, sandwich lunchtime, come home, open a bag of crisps, have a bottle of beer, cook supper. It probably consisted of pasta. I knew I was slightly overweight. Probably more than slightly overweight, but didn't feel it was sort of affecting me health-wise.
I think one of the most powerful things that I've learned as a doctor, having trained as an interventional cardiologist doing keyhole heart surgery on people, is that lifestyle changes are more powerful than any drug at preventing and treating heart disease, and they come without side effects.
I think this has got to be mainstream. You know, this has got to be driven out there for everybody to know about. You know, when Mike was on the ward in the hospital, there was patients with like 6 packs of Lucozade and grapes and energy bars and biscuits, and you know, and that was just seen as normal. And I think it's terrifying that we had to go against current medical advice in order to get him to where he is today. There's nobody ever going to look after you like you're going to look after yourself. And you have to get out there and you have to find the best way of eating. You've got to do research. And that's really unfortunate that you have to go and look. You know, it shouldn't be that way. There's enough documented evidence out there that says that this is the way to eat, to prevent heart disease, to prevent chronic illness, to prevent type 2 diabetes. People shouldn't have to look. You know, you should be able to go to your doctor and they should be able to tell you, look, this is the way to go.